Hello and welcome to the Renowned Coding Development Program overview or announcement. This has been in the works for a long time, and I really appreciate everyone for being here. We had over 250 signups for people that said that they were planning to attend. So usually when I do these live streams, I go into introductions, I go about saying hi to everybody, tell me where the weather is and all of those kinds of things. We're actually planning to also utilize this live stream recording to send out to prospective clients or even to, let's say, your managers, HRM directors, senior directors, CFOs, and those folks that may be interested in learning more about what a coding development program looks like. If that's something that'd be good for my facility or my team, let's say, has uncredentialed coders. Let's say my coders want to do other things. I have coders. I have a hard time filling or finding inpatient coders. Can I upskill and uptrain my ED coders to be able to do inpatient coding? Yes, fantastic. But how does that work? So because we're going to have so many questions just like that, I'm going to save some of the introductions or some of the shout outs that I usually do on these live streams towards the very end. And please, if you wouldn't mind, try to save some of those questions towards the very end. But if you want to go ahead and say, hey, if you want to go ahead and share in the comments how much you're excited about this type of program, how long you've known me and all of those kinds of things. If you want to share about the weather, that's fine. Do it in the comments. I'm just not going to be bringing that up to the screen. Perhaps maybe until a little bit later, if at all, because we may not necessarily have a lot of time. I really want to dive into the meat and potatoes about this presentation and how it is such a needed thing as to developing people. We're really at the stage in our workforce with our aging population, post-COVID, with the disengagement of folks having with the marketplace, that a lot more employers are realizing the importance of developing your own staff or having a partner like Renowned Talent develop that staff for you. So what I'm going to go ahead and do, I'm going to go ahead and jump into the presentation. If you missed my little introduction, hello, my name is Bertrand Lansico. You can watch the live stream or the live stream recording of this very presentation using the same link. I'm also going to have it on our YouTube channel. That's at Renowned CEO on YouTube. And the nice thing about YouTube, you can play it while you're working out, while you're walking, whatever you're doing in the background. Sometimes I even have my AirPods in and I'm just like listening to YouTube, whether that be a service or something. So you can do that as well. So it's going to be on YouTube. It's going to be on LinkedIn. And thank you so much for everybody joining us. Okay, cool. Let's go ahead and get started. So our mission is really to standardize healthcare talent access. When I started Renowned Talent 5 or so years ago, I was doing a lot of perm placements. Hey, Bertram, help us find an individual. Hey, Bertram, help us find an individual. And we were very successful in that. I mean, I think even within our first 7 days of being open for business, we signed our first client and we had a check coming in the mail to us. But things have certainly changed. So on the staffing side, I did a lot of those permanent placements because I needed to build up capital and investment money so I can do staffing. Getting involved in staffing has been fantastic, but still it doesn't solve the nation's problems. And can I get an amen in the comments if we need another staffing organization? We absolutely do not. If I would call any director, CFO, and say, hey, do you need another staffing company? They'll probably tell me, well, Bertrand, we're looking to reduce the number of staffing companies we have because of the vendor spend. And we're spending this money. And you know what's so funny about the staffing industry, especially within revenue cycle, HRM, and coding? That was really a remedy for interim interruptions in service, meaning they had somebody that went on maternity leave, or they had somebody that passed away, we had somebody that moved. So in the presence of that person not being there, we needed an interim service to help us. But that interim service has turned out to be essentially a permanent service, very expensive, right? And at the same time, it's like, well, if you're paying 2 to 3 times the amount of filling that actual person, what is that doing to your bottom line? A lot of conversations that I've had with CFOs and folks at the very senior level, half of the year has not even passed, but they have already spent their budgets. Janita, remember we were talking about budgets most recently with one of our clients? Janita's in the back, and she'll be coming and joining us here shortly. But imagine that you have a budget for your department and the half of the year has not even gone by, but you've already spent your budget. Where's that additional money coming from? And when things are tight, like in the marketplace right now, it's hard for CFOs, HRM directors, and the like to come up with reasons, excuses, even though some of those may be really real, right? I can't find people locally. We have a very hard skill set. We lost a vendor, our vendor is losing people, whatever the case may be. It's hard for them to justify the cost. Okay, so we've really tried our best not to just be a staffing service provider, but really look at the problems that our clients have, and whether that be within HIM, RCM, or CDI services. We do have specialists for that. But really, one of the passions of mine ever since I started within revenue cycle has always been helping out the little guy. I started in 2011, and very early in my career, behind the scenes, because I got challenged. I was out there in the marketplace recruiting for people with 3+ years experience for the latest inpatient coding job that our clients had. And the market challenged me. I remember Debbie in Pennsylvania, she reached out to me. She said, Bertram, you know what? Shame on you, because here I am, I have my credential and I can't get a job, and you wouldn't even accept me because I don't have 3 years of experience. And I spoke to Debbie. I said, well, Debbie, tell me a little about your experience. And I found that she was credentialed, but she had a hard time finding a job. And I said, Debbie, you know what? Why don't you go off to one of your local associations, bring coffee and donuts, and just see what happens in your resume, introduce yourself, ask permission from the host, etc. Crazy enough, she got the job. 10+ years later, she's still there. But unfortunately, that hack doesn't always work. They're truly clients that don't have the capacity, the funding, or they don't even know the people like Debbie that may be able to fill some of those openings. So I really saw and I see a gap in the marketplace. And ladies and gentlemen, let me tell you, the place that not only coding or revenue cycle, but even the retail space, Starbucks and all these other organizations are going and industries are going, they're going to more of a development program, right? We're not getting the amount of applicants or even the interest in the programs that we need. I recently had a presentation at an AHIMA function, and I had 2 presentations, one to more senior class and one to more junior or new graduates. In a new graduation class of 22 students, do you know how many people were looking forward to getting started in coding or working in coding post-graduation? Only 2. 2 out of 22 people were looking forward to working or even starting in coding, not meaning that there's going to be a coder for the rest of their life, but only 2. So what does that mean? That also means from the graduating class of HIM and RCM graduates, a lot of them are not even interested in coding. But you know what the shame that I would say that we have in our industry? The shame is that the people that are interested can't even get a job. The people that are credentialed can't even get a job. The people that have 6 months experience, 1 year experience, 2 years of experience, they can't even get a job. I met recently a CCS credential coder. She had her CCS for 4 years, ladies and gentlemen. 4 years. Sorry, got to figure out where the camera is. For 4 years, and she could not even get a job as a coder because she doesn't have prior experience. You know what I'd say? Shame on me for being a recruiter for so many years and I can't help that person. And essentially shame on us. Because what that means is that person has had that credential for 4 years. They've already renewed their credential once, because it's usually a 2-year span. Correct me if I'm wrong, ladies and gentlemen. But it's usually a 2-year span. So you're telling me that CCS is a hard test. They're coders working at facilities. They tested for the CCS that I have met, and they couldn't pass the exam. This person without experience passed the exam. They already renewed the exam, and they still can't get a job. And just talking to different people and realizing people within my ecosystem and my professional network have had experience developing and training people in this. And when I introduce Yanita, you're going to realize, like, this is crazy. Her experience is ridiculous. And she's done something like this in the past. You know what I said? Let's go. Because the only thing stopping us is ourselves. Okay, so ladies and gentlemen, I see a lot of comments. People are excited to be here. Like, a lot of good things going in the comments. But just first, please, let's identify that we have a serious problem. And hopefully Renowned Talent can come up with a solution that may work for a lot of facilities and health systems around the US. Okay? So just to learn a little bit more about the presenter. So I founded Renowned Talent in 2018, and we really hold ourselves to the higher standards of professionalism, commitment, excellence, integrity, accountability, and stewardship. So for us, it's not just about being a profitable organization. We really do it to the highest standard of honesty. We recently had an engagement with a client, and we actually had the opportunity to outside or put out a vendor that wasn't producing or doing well, but we didn't do that. We actually tried our best to remedy them, work with them as to their invoices and what was going on, totally above and beyond what we were supposed to be doing. But we were also a vendor ourselves, and they've been supporting the hospital for a while. We wanted to see what we can do because they still were supporting the hospital in some sort of facility. Other organizations I've been a part of or have heard about, it's very cutthroat. They're not going to do that. They're going to be like, you know what, you're out. Like, where's your term date? Like, you're out. And we are not those kinds of people. And I feel that one of the reasons why I probably have some sort of movement, or a lot of people follow me on social media, because they realize that that is just who we are. We're very passionate about what we do, and we believe in serving. We all got involved in healthcare probably because we decided not to be doctors. Like for myself, when my mom was talking to me early on, like, hey, you're smart enough, you have the grades, you should probably be a doctor. I said, Mom, you know what? I'm not really into cutting people. Blood, it's not really my thing. But healthcare became a haven or safe haven for me in a place of job insecurity and a lot of other things. So I think for the most part, a lot of us decided that, we're probably not meant to be doctors, but probably we can help out our work in healthcare in some way by helping others, right? And I also faced entry-level bias when I first started in revenue cycle years ago. I wanted to be a recruiter. No one wanted to hire a recruiter. I found a mentor that helped me out, but I know what it's like. And that's why I'm very passionate about this. Like, this is not just a new business model or a new business scam. And probably after this presentation, I'm sure there are going to be plenty of other companies saying they're going to have their own coding development programs or whatever, right? But have you known any of their founders have also faced it? I faced it for 3 years, ladies and gentlemen. It took me 3 years to get a recruiting position, a position that nobody wanted. But I also know, like that CCS coder I mentioned earlier, there are people that have not had or been able to get a coding job for years. But the coding development program, and I'll share more details in the upcoming slides, is not just about entry-level people. It's not just people facing that entry-level bias. It's also for everybody. And Janita, I'm going to be bringing on here shortly. She's results driven. She's skilled at coding structure, education, training. I like to call her Mama Bear because when she worked in the coding development program at one of her prior employers, she was a person that took the coders outside of the training and got them going on the real life charts. Hey, you know what? You're not just a trainee anymore. You are like a full-fledged coder, and she got them out there. But what I love about her, not just that she's knowledgeable, not that she's worked for excellent organizations and partnered with excellent organizations like HEMA to do testing and many different things in compliance, is that she's a person. She's approachable. And I've met compliance directors. I don't know what it is, but sometimes they're a little bit jaded. And I've always loved Janita because she's not like that. She's very approachable. She's the kind of person that, like, if your dog died and you cried, she would share with you that, maybe something happened in her past, and she would work with you. She wouldn't hold it against you. So she's always been one of the best and most knowledgeable people that I've worked with in, within revenue cycle. Okay. And with that, I would love to bring Janita to the stage. Janita, how are you doing?
Good. How are you today?
Doing fantastic. So we have a lot of comments. A lot of people are commenting about some of the biases and things that we face. And thank you for joining us today.
Thank you for having us.
Yes. All right. So these are some of the challenges that a lot of us face, ladies and gentlemen. A lot of medical coders prefer to work with vendors for better pay and benefits. I'm not saying that this is the norm. There are definitely some, when they're coming to retirement age or just for the job security or whatever the case may be, they're looking to work for a healthcare system. But I actually see that changing quite a bit, because a lot of healthcare systems, especially some of the largest, they have a dedicated outsource model. They have a vendor or a company that they're utilizing because it's just really hard for them to manage, or they just have so much stuff going on. I mean, at a very high level, ladies and gentlemen, you have to understand, if one day of coding is not done at one of these big healthcare systems, it's not just millions of dollars that's sitting on the table. It's billions of dollars. And I can tell you, I've also spoke to the folks that had to answer to the questions about why those billions are sitting there, not even receivables, but just pending to even go out to be sent to the payers. And it's not a very good conversation. I'm talking, these people's jobs are on the line. So when you understand the dynamic and how that works, that, hey, well, what, Bertrand, are you telling me that if somebody doesn't run their department well, and their DNFB is super high, they're going to get fired? Absolutely. Everybody's going to get fired. So even the CFO, believe me, their neck is on the chopping block too. So it's a very sensitive topic. And revenue cycle tends to be one of the second or third or fourth. It's in the top 4 or 5 for sure, greatest spends for healthcare systems. They want to make sure they're getting that revenue as much as possible. And I'd even say revenue cycle even taps into CDI, because CDI, as much as it's maybe a nursing function, it really deals with the records. It really deals with the coding. A lot of CDI specialists have gone out to get their credentials, or vice versa. They're first coders and they got out to their CDI credentials. So I would say that's more on the revenue cycle side than anything. And a lot of revenue cycle teams are siloed. And unfortunately, COVID probably pushed this more in a siloing, or pushed us to more silo than ever before, right? We're not really getting together. We're not collaborating. A lot of teams and departments are not asking them to speak to other teams. So I've even had clients tell me that the CDI person wanted to work with a coder as to some of the querying issues that they had. So they wanted to educate them on some things, pull out some coding guidelines and work with them on that. And the person was told, no, don't do that. You're not allowed to talk to the coders. And the person's like, well, aren't we all part of the same team? We're actually, like, I'm talking internal team member to internal team member. And they were asked not to do that. So with the silos being in place, it's hard for us to collaborate. It's hard for us to learn. It's hard for us to grow professionally, right? There are not a lot of opportunities to cross-train or grow staff. Staff may be not interested to cross-train. This was interesting. This is something that Janita and I experienced recently. You know, Janita talked to a group of ED coders. They were probably overstaffed in ED coders, and the ED coders told us, no, they're not interested in upscaling. And we're like, you could make more money. You'll still have the job security and the benefits, but for you, you're actually getting trained. You don't have to pay to get trained and any of that stuff. And they said, no, they're not interested, because for them, it was just about a paycheck. It was just for them to work there 32 to 40 hours, whatever it is, and then they're gone. Yep. And I'm like, wow, this is crazy, right? This is an entitlement on another level. A lot of entry-level coding jobs require years of experience. This is a phenomenon that still puzzles us, right? There's a lack of knowledge transfer, as current staff is not involved in coding development. When we were working on site, unfortunately, you know, I'll say it, this was possible, right? The ED coders were able to glean and learn from the same-day surgery coders. Even for myself as a recruiter, I was able to listen into some of the calls of my mentors and talk to them and run into them and talk to them in the gym and different things, as we had a really good work site. But within that work site, you're able to collaborate, learn, meet with people. If you had tension with somebody in email, you'd see them in the hallway, and you're not going to fight, so you're going to be like, hey, let's squash this right now. You're able to talk to them. But when you're siloed and when you're remote, you really don't get that knowledge transfer. You don't get some of those coffee talk conversations, and that is actually hurting a lot of organizations right now. There's a lack of audit or management opportunities for internal staff, and AI has already started coding entry-level coding charts. And I'm talking autonomous. I'm talking, it doesn't have to see a person. The chart gets dropped, the system does it, and it goes out. So what that is telling us, and not every system is ready for AI, right? But what that's telling us is that now you're telling me, Bertram, so the entry-level coders coming in probably are not going to be coding ED because the system's going to be doing that. So what do the entry-level coders now need to code? Well, maybe they need to code minor same-day surgeries, right? But who's going to train them on those minor same-day surgeries? So this is the thing. When we were looking at a lot of these issues that revenue cycle is having, we were also asking ourselves, like, how can this be remedied? Okay. The threat for industries right now is a lot of hospital jobs with most employers are nearing retirement, especially HM and coding. So a recent survey, and you can look this up yourself, Google it, coding is at close to 25%. So within the next 10 years, these people are going to be gone. Right? We just have an aging population. And this is also really understood by a lot of you, as a lot of you probably entered coding, probably not as a first-time career, right? One of my more recent contacts was a guest on the Roundup. She was actually an entrepreneur, right, for 30 years, raising 5 children as a stay-at-home mom as well. And then she decided to become a coder. And that is a very common story. So if you just do the math, it's very easy to understand that, wow, this person probably started within coding maybe when they're in their 50s or so. So how long is that person really going to work within retirement age? So we have to really realize what's happening. And then my question to a lot of HRM directors and CFOs, what if you lost 25% of your coding staff? I'm not trying to do ageism or anything, but let's just look at your team. Look at the coders that you have. Look at their ages. And realize who's going to be leaving in the next 10 or so years. We have a problem, Houston. We have a serious problem. And as hard as it is to find inpatient, outpatient, and profi coders, because I find them on a daily basis, and I know how hard it is to find them, right? If you have to replace all of those people, how would you do it? This is why the coding development program is so important, ladies and gentlemen. This is not just something that's like, well, hey, this would be good to have. Like, we have a serious problem, Houston, I'm telling you. Okay? So, ladies and gentlemen, please look at your staff, realize what you have, what you may not have. And if you really had to replace these individuals because, they're retiring, they're healthy, they're going off to do great things, spend more time with their family. Where would you find their replacements? And the best time to find their replacements is right now. You don't wait when somebody's retiring to find their replacement. My mom is actually a retirement age. She was supposed to retire next month, and they actually sat on resumes of replacements for 6 months. Applicants actually told my mom, hey, I thought the job was closed because I didn't hear anything. Poor recruitment, but anyway. And now she wants to leave, but she can't leave because she has had no time to knowledge transfer the person that actually has to move to the U.S. Virgin Islands to replace her. So I was like, yeah, I'm going to be here for a little while. I'm like, well, Mom, I guess it
It
is what
makes
it
it
is.
tough. It makes it tough. I just
Very challenging.
spoke with someone that had talked about most of the individuals in their department, to your point, Bertram, about the coding with 25%. Longevity, retention is important for any organization. Don't get me wrong, and it's there. But when you got those organizations that's what's sitting in their department, and you're right, they're getting to where are looking at retirement, or maybe they just want to change jobs.
Mm-hmm.
They want to go out and be an entrepreneur themselves now instead of being in that coding area. So there's where that change starts to happen. And what are you going to do? Where are you going to find those individuals if that's 25% of your workforce already, and there's
Correct.
4 of them that leave and there's 6 there?
Correct. And
So
also the thing
depending
is,
on the
that
size.
if these people are looking to retire, do you really also have a chance to upskill them or have them learn other or help you out in more challenging cases when it comes to your coding
Hmm.
mix? Probably not, because Bertram, I'm actually on my way out. I need to spend more time with Timmy and the boys rather than, learning coding or getting my CCS. So for us also, we're not pointing fingers and blaming people. We're just stating the obvious and what it is. We understand that these people are of a certain age, or they may have a certain demographic, or they just truly may not even have the time. I also know some people that are working 2, 3 jobs. So does that person also have, the opportunity to go out and, let's say, spend a lot more time honing on the crowd? They may not. They may not be in a place financially to do that, right? Or even just have the time financially to do that. So we're not blaming. We're just stating the obvious as to what it is. But also, when I read this statistic, I was shocked, and I'm like, wow, this is a problem.
Hmm.
Okay. All
Exactly.
right. So how do you win the talent war in 2024? A lot of employers and recruiters, unfortunately, we can't take Peter to pay Paul anymore. This has been recruiting for the last 15 or so years. Hey, I have a inpatient coding job. Inpatient coders are not being made anymore. A lot of the facilities and the employers and the vendors that I used to love working with some of these people because they developed their own coders. And so crazy? The retention rate for those coders was ridiculous. You couldn't recruit those people. But I was happy to have them because people were entering the workforce. They would hire a class of 20 people and they'd get them trained up and they're entering the workforce. But now that company was bought by an IT company. The IT company has really no interest in education. So now they're just being a coding vendor. They can do whatever they want as their company, right? But now we're not having a lot of those opportunities. So we can't take from Peter to pay Paul anymore. All right. And a lot of the employers who win the war on talent without going broke, without spending ridiculous amounts of money, they create or they train growth opportunities for their future coding needs. Okay, so a couple of examples here. Alabama healthcare system that I'm working with, they actually hired 40 collection specialists to become future medical billers. So the collection specialists will help them on their outstanding payables, and we're talking about the ones that are outside of insurance, obviously. But then they're actually working with, and they hired a local instructor to work with these people that are all within this like little center, right? To become future medical billers. They're cross training them on the job, and as somebody leaves or goes out or does whatever, guess what they're going to do? They're going to cross train the next person that's coming in. So you really have to be smart about how you can do this. Also, this is very cost effective, because you're not paying market rate for medical billers, as an example. You're bringing them in as collection specialists, and as they get trained up and as they go to be medical billers, you're increasing their salaries. But still, it's likely less than what that person was going to be, or if you had to hire medical billers straight from the marketplace. Also, because you're training them on exactly what you need in the systems that you need and all of those things. Okay. Walmart also isn't going to dwell on a worker shortage. It has a new pipeline program that will fast track staff to higher paying, hard to fill local jobs and opportunities. As we know, Walmart is sometimes in very rural areas. They couldn't get, let's say, the pharmacy tax and some of these other non-licensure positions that they couldn't fill, and they're also doing it too. So My question to a lot of the employers, right? And we're going to be sending this video out to a lot of employers and contacts, directors, CFOs that we know. How many coders do you need to be fully staffed? Because that is a real question. We had a conversation with a client recently, and we projected like five or so Janita. You know what they told us?
Yep.
We need 12. We're like, 12? Goodness.
Mhm.
Because they even realized, like, hey, if I really want to be put in the time and the investment, and if I really want to be fully staffed, and if I really want to only utilize coding services vendors just for those interim needs, just for that maternity leave, paternity leave, whatever that is, I also probably need to replace some of those positions too. Or maybe they did an audit and some of those vendor coders are not up to snuff. That's a good opportunity to either, do what you have to do to those particular individuals, or replace them with a potential internal person. So, Janita, I would love for you to share with the audience about your experience and how you worked on a similar coding development program in the past.
Sure, absolutely. I think one of the things that we've all experienced was back when we moved to ICD 10, right? That's where I got
Mm-hmm.
full fledged into it when we looked at trying to parallel I-9 and the I-9 to the I-10, and a lot of these
Yes.
larger organizations were prepping for that. I was happened to be in one of those situations where I was able to be part of that. One of the things that we were looking at was how we could use internal staffing to grow them internally. We had open FTEs across the gamut of the size of the organization, and one of the things that we decided to do was to grow outpatient coders to inpatient because that's where they felt, or we did at the time, that the biggest volume was going to hit for reimbursement was inpatient because of the I-10. At the time it was about specificity. Did we have the right documentation? There was always that scare that, it would be a little bit shortage, a longer period of time for the coding world to get into that and actually get pushed through that, which it took a lot less time than they thought. Everyone was thinking 6 months or more, 3 months, and we were there. So,
Okay,
I mean, I think
hold on, Janina. So you're telling me you started the code development program, you started these folks on more outpatient just to get started, right? So they can grow into inpatient coders. And how long did it take for them to start being productive and actually working in the charts?
productive, it was a year.
Okay.
Productive a year. What I was just talking about was just that transition from I-9 to I-10, the
Yes.
specificity part and the coding. So, in starting that program, what we did was we took nominations from the different areas of individuals that they felt would be beneficial, that would be probably very productive in, and they felt would be very good inpatient coders from their outpatient experience. So we started off small. We took six. And then from there, we went through and they went through a program which was electronic. We worked with a vendor to help us with that, which would help it speed it up and set it up in modules, and from there they went through grading and all of that. We were able to give them live charts in the sense that we just redacted them and put them into the program so that they could be utilized right then and there. So at that time, once they got through that, then they went through not only that first part of that training program, they went through mentoring at the same time.
Mm,
The things that they were maybe low scoring on, that's where I was there, also mentoring them along the way. I also had a coworker that was helping me in that program as well. Excuse me. And then we moved them out from that training portion, and then they went into to the coworker that I was working with. Then they went in with her to actually be going out into these different areas of specialty. Being it was a large organization, there was a
hmm
lot of different specialties that they could get into: orthopedics, burns, that kind of thing. So in that realm, those were some of the internal staff, and we also took new grads. We also had a new grad program that we started where we went through and we interviewed students from the
Mm,
local colleges, and that's how we chose the individuals that we were looking for to come into a new grad program. So we kind of solidified them together to help us get into that I-10 arena and also to start to build that. Now at that time it was fantastic. There was incentives involved for internal staffing with relationship to that, and then also it was to also make them subject matter experts, right? Who doesn't want to,
mm,
what coder, not what coder, a coder should always want to be marketable, right? One of the things in the
Mm,
industry, in my opinion, and this has been my professional experience my entire career, I have had the privilege of having great mentors and also have been thankful for also being able to do inpatient, outpatient, and prophy my entire career.
mm, wow.
I've always encouraged coders along the way, mentoring them every chance I get. Every turn that you have where you can grow and expand yourself, be sure that you do it. It only makes you more marketable than you can ever imagine. And
There you
that
go.
is how I have built my career along the way. And then also just to allow me, even if you're paralleling yourself, right? One of the things I think as a coder we forget, at least in my experience, is that we forget that if we take a look at what we want to achieve, we may be paralleling ourselves in salary, but
Mm,
we're gaining the experience in a slightly different role. It's adding on a little bit more perspective, but also making you much more hugely marketable. So one of the
correct.
things that I think right now in the industry that we've kind of lost since I-10, and then we kind of hit COVID, but COVID didn't really, I don't think, impact that so much, was the fact that we were all prepared for education, learning something new, being prepared for the revenue cycle impact that every organization felt that would be hit, and so they developed these programs. They developed education. And they continued it for a while, and then it just kind of, some organizations, maybe not all, so then it just kind of started to fall away. And
Yes,
then
yes,
they
yes,
kind and then they kind of just kind of stopped, and it kind of dissipated. Um,
yes.
Now, some organizations do it through an audit program. Some of them have really strong audit programs, and they continue to provide that. And that's where some of those changes have kind of, again, they went through, they kind of hit on some of those topics as far as audits with the trends, but yet they don't sit down and they mentor those individuals that probably need it more than the entire group, right? Because that's how
Correct.
we continue to grow a
Grow.
coder, is to expanding their knowledge and really making sure that that is where they want it to be marketable, that they want to grow as an individual. And that's, to your point, unfortunately there's going to be some that don't, that's just not where they want to be, and or that's just not how they want to fit in. Well, it doesn't take long for those people to realize that maybe they want to move on, or they take a different role. One of the things I think that is a good advantage too as a coder is that there's so many opportunities as you continue to grow and learn about revenue cycle. There's edits, there's billing in the back,
Mm,
billing opportunities in the background. Now that revenue cycle is changing so much, we talk about technology advancement, right? We're also looking at what can we help provide as an education program that will prepare a coder into moving into that realm.
correct.
We still know that AI is not, it's human development. It's not completely an artificial intelligence all on its own. It's been created by humans. So there's still garbage in, garbage out. I have not seen anything that says that it's 100% effective, right? We still have to go in and look at some of that, because that is still some of the way that the programs are run these days. They're still quality controlled everywhere. So
Yes.
there's a lot of huge opportunities right now in the space to continue to grow the revenue cycle as far as coding, and revenue
Hmm.
cycle itself in the billing side of the house. So
So,
there's so much.
I'll also second that. As much as the threat of AI is coming to take jobs and all of those things, I've actually helped some of my recent clients that are AI companies. They're hiring coders. They're hiring
Yeah.
coders because they still need somebody to quality check what the machine is doing. The machine will learn as much as it can from the coder, but at the end of the day,
Hmm.
it takes a person to do it. There's another HIM relatable industry that was heavily affected by AI. If you remember the transcription industry, ladies and gentlemen, that was heavily affected by AI. They all said that AI is going to come and take the transcriptionist jobs and nobody needs transcriptionists. Guess what? Today, you can't even find a transcriptionist. Companies are so hell bent on trying to find transcriptionists to fix what the machine is doing. They, as too, have their own training and code, well, transcriptionist
Quality.
development
Hmm.
programs,
Yep.
quality programs. So, what am I telling you? All I'm telling you is that we are getting ahead of the curve. We already know that the future of coding is not coding services, it is coding development. And the companies and healthcare systems that realize that and realize, you know what? the AI company is selling you, they're selling you Epic, for example. We all heard that Epic and these EMR systems are very expensive. I'm talking hundreds of millions of dollars. We're going to come in and solve everything. I realized lately, and I learned that Epic is actually very expensive to maintain. It's almost like a Mercedes. You can't just go and get the $20 oil change anymore. It is very expensive. I'm talking millions of dollars of yearly investment. And what is the AI company telling you? AI company is telling you, yeah, you buy this product, you pay us X amount, it's going to be fine. But the AI company themselves is realizing you still need quality control. And if you remember, there was a payer most recently in the news, feel free to Google it. Their hand got slapped. Why? Because they're utilizing AI and automation to automatically approve or deny claims. As soon as the government bodies found that out, they got their hands slapped. But if they went and they said, we did this, but also we had people quality check what the AI was doing, so it was a collaboration effort. It wasn't just an algorithm that we just automatically denied claims. That's where they messed up, because they didn't have that human component. So the companies and healthcare systems that realize having that human component is actually going to be essential to my success is going to figure it out. So Janita, she's here, and I'm going to run through the slides really quick to kind of pick up some of the facts that she may have touched on. So she started in 2014 in that particular program, worked for the largest health conglomerate in America, and they hired 50, ladies and gentlemen, 50 entry level or people that were promoted into this coding development program, right? They had a dedicated management team. They had a really great educational platform that we also have access to, and then a quick turnaround time. They were not fully productive in 3 months. They started essentially getting from education and transferring to working within charts and doing some very simple radiology, maybe some ED, or just very low-level labs charts within 3 months, but they're fully productive within 12 months. And then out of the 50 entry-level coders, within 9 to 12 months, 48 coders were fully up and running on inpatient coding, and 2 out of their choice were working on high-level same-day surgery outpatient charts. This is very possible. This is very possible. So in conversations that I've had, ladies and gentlemen, some people have asked me too, like, well, Bertram, if I get coders with the coding development program, I need 5. How long could I really start to see results, right? And this is more of a timeline rollout as to how it would work out, okay? So why the coding development program, right? So we're passionate about helping facilities get the right talent and getting coders hired, right? Janita already has experience with 50 entry-level coders to be fully productive within 12 months. The education platform can start immediately. So let's say a client reaches out to us next week. Hey, Bertram, we're good to go. Let's get 5 coders. We can actually work with them. And we already have over 250 people that are interested as applicants as working as entry-level coders, or even, let's say, within current staff, okay? Because we also have an opportunity to upskill current staff. We can start immediately with them working on education, being within the 450, 70 or so hours of education. And from there, get them access to the systems, and then start getting them some cross-training on the systems. After they finish with the education, transition them to the system work within the system, working on the live coding, auditing, and just work with them that way, okay? And it's also an amazing opportunity for healthcare systems and employers to offer growth opportunities or cross-training opportunities for current staff. One of the things I realized with us having a very short attention span, maybe Instagram or TikTok's to blame for that, whatever, but one of the things is that people get very bored in jobs. The ED coders I talk to, they want to do outpatient coding. The outpatient coders I talk to, they want to do inpatient coding. The inpatient coders I talk to, you know what they want to do? They don't want to do inpatient coding. What do you want to do? I want to be an auditor. The auditors that I talk to want to be managers. But we do not have the cross-train opportunities or the ability to do that. But with Renowned Talent and the Coding Development Program, we do have the opportunities to do that for you. And there's also huge cost savings. Because that's also one of the things that a lot of people have asked me about. Well, Bertram, if I'm interested in this type of program, what is it going to cost me? Okay, because I can't just go to the CFO with this presentation and it's all good, right? It's not going to be good because I don't have numbers. CFOs especially, they want to know numbers. Cost savings, actually. You're looking at the cost of 1.5 to 2 coding development program coders, and this is more on the entry-level side, is actually equal to 1 coding consultant. So we're talking about whether a bill rate that a coding company is charging is, let's say, 60, 65, 70, $80 an hour. You can actually hire 1.5 to 2 coding development coders utilizing our program, okay? Or if you want to cross-train people, so we can take out the all of the costs associated with actually hiring that employee and all of those things. If you want to develop your own employee, 4 cross-trained coders that you have employed currently to 1 coding consultant. We'll just charge you what the education cost is going to be, as well as the training. That's it. Well, of course, with training comes auditing and all of that piece. The way that we figured it out, and the way that I've come up with the numbers, I've come up with a number to include not only hiring that person, but providing them great insurance, benefits, a full-time W-2 employee position, the education, the training, all of that within that price. So we're not tacking on, hey, you know what, you have 5, let's say, code development program coders, and then you need to pay for a manager. No. This price has everything included. It's bundled pricing. So straight out the gate, what you're going to need, okay? And also there's a temp to perm hiring option available. So let's say somebody wants to, a healthcare system, they want to hire 5 coders through the program. They want to have them with us for a little while, but then they have a plan, or they want to bring those people internally, not working with Renown, but actually internally with that healthcare system. We do have that option available as well. So if you just want to engage us temporarily to help you, let's say, plan for that retirement generation or for some of the gaps that you have within your organization, we have pricing and we have the options available for that. What we're saying is that these coders do not need to be Renown employees forever. They could be your employees in the future, okay? And we can help you identify people locally that can be in the program that will allow you to hire them internally. As I said, we already have 250 people interested in the code development program being your entry-level coders, okay? What a typical new client rollout is going to be, we're going to identify the coders of the people that you want to put through the program. As I said, our starting cost is less than $40 per bill rate hour, and that includes wages, benefits, equipment, education, as well as training. We're going to hire training managers and get them assigned to those coders. We're going to request the EMR access while we have the coders working in education, and we're also going to get staff ready for kickoff. So with us being post-graduation season, I can tell you there's no better time than now for folks to actually start the code development program, because this is when everything is in flux. This is when people are moving. This is when people are identifying where their jobs are going to be. Even before Timmy and Sally start school, right, in August, or when your kids start school, this is one time when everything is in flux. So it's a good time to get these people locked in so they can, let's say, be dedicated on that schedule before the kids' schedule starts. I'm a parent of 2 kids myself. You know, I have kids that I know we have soccer, we have other things coming up, but things are in flux right now. We're still trying to figure it out. So it's a good time to get those people locked in right now. And really what the game plan is after we have those people on the education with system access is to educate, train, audit, and report. Okay, so we're going to conduct audit on the coders. We're going to educate, train, and report them to the client. We're really good about reporting and auditing our staff. Okay. So really, this is not just going to be, let's say, a coder or coders and a manager. This is going to be a team effort. Okay. So if you're going to, I'm going to start at the purple side and just kind of work my way around. Okay. So you're going to have your internal staff focus on the more challenging charts and specialties once these coders get started after that 3 or so month development program of them getting or coming from the education and then getting onto the platform. You're also going to have coding managers doing daily management of schedules and weekly virtual meetings. Okay, this is when we're bringing people in, for example, the entry-level coders to cross-chat or ask questions to current coders or coding staff. We think that's going to be really essential because a lot of these people that are retiring, if you told them that we have a coding development program and we'd love for you while you're coding or while you're working to answer a few coding questions of some of our entry-level people, it's going to be fantastic. One of the things that I've loved when I was learning recruiting in the industry was not working with my recruiting managers and directors, is actually with my tenured recruiters, with my mentors. They really taught me a lot. I'm not saying that my managers didn't mean well, but it means a lot when you're working with somebody that's actually currently doing a thing, right? And how they do it with the same system and all those things. Auditors are going to be reviewing charts before they're released and provide education as needed. We have the online education program and it's proven, Geni's even used it in the past, to make really strong medical coders. So that is even without a doubt, okay? Reporting is going to be important because we have to track education and training progress. For example, the education platform that we have, if a module is scheduled for, let's say, 30 minutes, but somebody spends 3 minutes on it, we can tell immediately. So it's also something that you cannot fluff, okay? We're also going to have contracts for these people going through the training program. So for example, somebody can't just start on the training program and be there for 3 months and then decide to leave or whatever, or like just like ghost us or disappear. There are actually going to be financial obligations to that. And that's one of the things that Janita's employer utilized or did in the past. And that was also key to holding retention. But also because of the lack of this type of program in our marketplace, we also believe that's going to create great retention as well. Because folks know that there are not a lot of places, if any places, that folks can go to the marketplace and get trained to become tenured and experienced medical coders. Okay. I'm also not too worried about retention and, let's say, companies coming and stealing these people, because you have to also realize too, these are going to be coding associates. These are going to be entry level coders essentially, right? So even if, let's say, a big company out there wants to recruit them, they can't just simply take this person and put them on a facility or a client that utilizes Epic or the same system. Okay, because even though they can charge that bill rate, a lot of the companies within their contracts have, you need to have at least X amount of years of experience working on our clients. Okay, Jeannie and I, we've seen the RFPs, so that also creates retention for those people. Okay, a lot of the coding consultants and internal staff will Bertram, what about us? Like, what are we going to do? Are we just going to fiddle off thumbs? No. There's a lot of opportunity for all of you to cross-train, educate, and cover current coding clients and charts. So with Renown's ability as well, let's say you have 4 coders that you want to put in the training program. You want your ED coders to be outpatient or inpatient coders. Great. But who's going to do the coding while they're in education, while they're getting audited, while they're working one-on-one with their mentors and their educators and trainers? Renowned Talent can provide the staff to cover their hours and what they're doing, so your dollars essentially and your charts can still go out the door while they're in education. And then after they're fully up and running, or you find your replacements or whatever happens, then we can pull those consultants off because they're truly on a temporary basis. Coding consultants, and I even tell my internal consultants this, coding consultants are only supposed to be there temporarily. You're not supposed to be there forever. But our goal and our job opportunity and our job security for our coding consultants is to get those coding consultants from your assignment onto another assignment. Okay. When that's going to be and all of those things, that's not necessarily your thing to worry about. We're going to take care of that. Okay. And the internal coding staff can focus on more challenging charts and specialties. So for those folks that you truly have talked to, they do not want to upskill, you essentially don't need to pull them off of anything. They can just work on some more challenging charts or just assign them queues for things that you do not want the entry-level coders or the code development program coders to be working on. Okay. And please realize, in the middle of this slide, I did not just put entry-level coder. This is for anybody who's going to be going through this. Even, let's say, an ED coder working for a facility right now that's going to be upskilled or uptrained on outpatient code or inpatient coding. This is for them too. It's the same process. Okay. So really, assignments for everyone. For clients and hospitals, it's going to be a big assignment and a big opportunity for you to offer internal growth opportunities to current staff. A lot of tenured coders and consultants, you're going to have an opportunity to learn other skill sets or cross-train on auditing as well as managing or training, because we're also going to need a lot within Renown. A lot of coding managers, auditors, and educators, more opportunity to you. I know a lot of educators doing a lot of other things, for example, auditing, because they don't have enough opportunities since or post ICD-10 to just spend more time educating. So a lot more time education. And of course, entry-level coders is going to create a great opportunity for you because there are not a lot of entry-level coding jobs out there. There are few employers I've learned over the years that do this, but more and more are not pursuing this program. So for us, this is not just going to be like something we're going to be doing through 3 months. This is going to be a dedicated service line of Renowned Talent moving forward. Okay. All right. So the key benefits really quick, and then we're going to open up to questions and answers. We have a fast service. We can start rather immediately. Of course, we can also just start people on after we have a signed contract with a client. We can start people on the education and get those entry-level coders hired, right? We can customize it to the client needs. So not everybody needs to start on ED coding. If folks are very high level, let's say on outpatient, but you want to get them to inpatient, they can start at that level as well. We plan to only work with a domestic talent pool. That is key for a lot of things, culturally as well. We have excellent reporting. We're going to be removing silos, and that enables knowledge sharing. We have over 200 interested candidates and entry-level people waiting for these opportunities. We will be providing equipment. The talent will be contractually obligated to complete the training program. Competitive benefits, PTO insurances, and professional development. And we have had high retention rates with the code development program. So really, we're hitting on a lot of things. And I know this presentation may not necessarily be able to go in depth enough with certain individuals. Let's say a CFO, if he really wants to learn, or she wants to learn more about the code development program. And that's why we're going to be, at least at this point, taking some Q&A. I have a hard stop in 10 or so minutes, but I want to go to the chat. Now, for those who may or may not be familiar with this platform that I'm utilizing, it's fantastic. It goes to a lot of different platforms. Unfortunately, not all of the chat questions come through. So I'm going to try my best to go to, LinkedIn as well to get some of these questions. But I appreciate each and every one of you for being here. I appreciate Janita being here. I appreciate Janita being part of the team at Renown because she has experience to help us do this. I'm kind of like the puppeteer per se, the mastermind behind some of this stuff. But I mean, I always tell people, Janita's a boss. Janita says you need to go, you need to go. Because I have to rely on her subject matter expertise. I am not a coder. I've worked in coding for over 14 or so years. I mean, it's been great. But Janita is really the person that knows what she knows. So I trust a lot to her. So feel free to email me, give us a phone call, or go to our website if you want to learn more about the Coder Development Program. That is coderdevelopmentprogram.com. We made it super easy for you. If you know Renowned Talent's website as well, you can go there as well. Okay? All right, so some of the questions. Here you go. Hold on. So a student on their way to certification. Unfortunately, no. You need to have your certification in hand before you apply to the jobs. And where would you apply to the job for the entry-level medical coder? That would be at renownedtalent.com/careers. Okay, so if you're a student, hold off. Make sure you have either an apprentice or some type of certification. So CCS, RHIT, RHIA, CPC, CPCA, any of those credentials, you need to have that in hand because that is a firm requirement for the program. How do you get added to the number of coders? You need to apply online at the careers page on Renowned Talent's website. Janita, was there anything I missed while I go through I go through some of the questions?
No, I think like you said, it's a lot of information all at once, and
Yes.
definitely, not all of it could be covered in a presentation like this with not enough time, obviously.
Correct. Okay, thank you, Janita. So are you saying it's a paid mentorship program? No, this is not an internship. This is not a mentorship program. This is you getting employed as a coding associate, getting trained on coding. And that's the thing. Like what I love but also hate about revenue cycle and healthcare is all of these internships. Because internships or externships, no one accepts it as hands-on experience. So what we're saying is we're not doing that. We're not doing some type of internship. No. You're going to be a medical coder. You'll be hired on as a medical coder. You'll have medical coding associate or something on your offer letter. You're going to have it on your LinkedIn title, for example, and you're going to be working as a medical coder. Yes, you're going to be spending some months at first just working within education. Perfectly understandable. But our job and our plan, and this is why the healthcare systems are so important to this process, because we need access to real life charts. Even if I have somebody in education for 12 months, if they don't get their hand on a chart, how can I even tell if they're good? So this is also a retention and making sure that our clients are getting what they're paying for. Would you want to pay for somebody to be in education for 12 months and then realize that they don't know coding or they can't code or they don't like coding? We want to get them to the real life charts as soon as possible. You know how they train recruiters when I started back when? They got you on the phone. Hey, Bertram, if you can't cut it, they know really soon. And they would make the cuts as necessary. And you know what? I respected that because, even for me, I wanted to find out if this job was right for me. Okay, so this is not a paid mentorship, internship program. No. This is you being hired as an employee. The clients are paying us. We're paying you as an employee. Okay, this is not something you can sign up for. You cannot sign up for this. If you want to help us, and I know this is something that I want to talk about. If you want to help us, all right, I'd love for you to talk to HRM directors, CFOs, or even just people you see online. Let's say somebody posted an inpatient coding job. You should tell them, reach out to Bertram or Janita at Renowned Talent and let them train me as your inpatient coder. What are you talking about? Somebody's offering training for inpatient? Yes. And I'm living in your area, but you can't hire me because I don't have 3 years of experience. Janita and Bertram can help me get or us to work through that 3 years experience. That's how you can help us. At Renowned Talent, we do not have salespeople. We're not a coding vendor. This is not what we plan to do. And I actually don't plan to hire salespeople. I've tried it 2-3 times. It hasn't worked out. And I've always said to Janita, and we've agreed on this, let us have our clients and the marketplace be our salespeople. So if you see a coding a coding job posted and it says you need 3 years of experience, comment to that recruiter, that hiring manager, reach out to Bertram, and he will train me to be your coder. And it's affordable. Because think about it, they probably have to pay more than $40 an hour to hire somebody with experience, including their benefits, etc., etc. And the truth is, it's absolutely true. So for somebody to say that they can't afford this, they actually can't afford not to take advantage of this opportunity. It just doesn't make sense. I've actually worked with inpatient coders as of recent, and a lot of them are asking more than $40 an hour right now. So, I mean, it just, anyway, we'll save that. So how do you get added to this 250? You apply online. I'm going through trying to get the questions here. I know we have 5 or so minutes left. Thank you. I saw a lot of thank yous. I saw a lot of shout outs. I saw a lot of those comments. I really appreciate you. Probably tomorrow when I have time, I'll go through the comments and I'll reach out to each and every one of you. Thank you for being here. I really appreciate the turnout that we had. Okay. How to get started with the program? You allow the decision makers at hospitals, HRM directors, CFOs, anyone hiring that Renowned Talent has this program. You can apply, but let them know to allow us to train you to be their coders. Okay. So what happens after you apply? After you apply, you're within holding. We can't really do too much until we get a client that says or gives us permission to hire within a certain facility. So you have to understand that some clients, they will truly want to hire you as their permanent employee in the future. And with that, they have to be able and qualified and enabled to pay for taxes, for example, in that particular state. So I can't hire somebody from Washington State or California to work for a facility in Georgia. They just may not have that ability. But once a client allows us to know that they can hire nationally, then we can work with them. If a client is also not looking for these coders to be their coders permanently, let's say they just want, Renowned to manage these coders indefinitely, we have that option available as well. Okay. But what happens after you apply? At least for now, you stay within holding. Let's wait till we get at least a client or two on our boats, and then we'll let the market know. We'll notify you as to these opportunities as we have them. Because that's what I'm going to do. As soon as I have a client, let's say, come through to let us know their requirements, we have the signed contract. I'll be going to all the people that applied on Renowned Talent's website and let them know about their requirements for those opportunities. Okay. All right. If you applied prior to the presentation, do you need to reapply? No, you do not. All right. Chrissy says she's so excited for this to take off. Yida says that she loves this. We love it too. We think it's going to be fantastic. Can you share a flyer with some of the verbiage? We are working on that currently with our marketing intern. So I'm going to have something on that in the future. Great program, Janita. It's definitely needed. Thank you. Will there be a replay? You can actually utilize the same link to just replay this, right? After, I think, a minute or so after the presentation, it's going to be just like a LinkedIn video, or you can go to YouTube at Renowned CEO, and the same title, you can find it, the Coding Development Program announcement. All right. Yida says, this is crazy. This is going to change coding as we know it for new coders. I believe so. I believe so. I really believe so.
That's what we want it to do. That's the opportunity that we're looking to provide, especially with the organizations.
Yep. And I know, I know some of my buddies at some of their companies are going to be looking at this and they're going to say, Bertram, you're crazy. They're going to say, yeah, no, this is never going to work out. Well, Bertram, how can you be profitable as an organization charging $40 a billable hour? Because I know what they're charging, and Jeannie knows what they're charging, right? It's much more than that. But we're not doing this to be rock stars or to send people on incentive trips to Key West, ladies and gentlemen. We're doing this because the clients need it and because the industry needs it. And what's so sad about those incentive trips, and I'm so sorry to call this out, but let's just call it out as it is. Who's paying for those incentive trips to send all those sales executives to that ranch or to the Key West? The hospitals are paying for it. The same hospitals that are closing because they don't have the financials to back up what they can't even do for their own internal staff. So what we're saying is that we're not that type of company. We are running on, razor thin margins. And you know what? If it's a loss for us, it's a loss for us. We'll make it up on the next one. But this is such needed by the clients, also by each and every one of you. And I think a lot of the people that know about this and that have been a part of this or a part of this industry recognize that this is a problem. You cannot, right? I had a client reach out to me the other day and they said, Bertrand, we need 10 inpatient coders. And you know what I told them? I can't help you. What do you mean? No one has 10 inpatient coders that are available. there, 10 inpatient coders don't exist. I have to wait for 5 of them to probably fall off our opportunity. The other 5 that are on the market, 3 of them probably got let go because they had low productivity or low quality. So that I can't. That's why I'm somebody I feel safe enough to represent. And I'm like, well, what if you could develop your own people? What if, yes, you need 5 or 10 now, but what if you can work towards actually having something that is solid and people that are trained on your systems? And this is the great thing about systems too. Not every facility is on Epic, right? One of the challenges that Janine and I have faced with our consultants is that the system that the facility has may not be the most marketable system or the easiest system to work on. Some of the coders feel like they have to do things twice, right? Perfectly understandable. But if you also could develop and train your coders to that system, it's almost like me. My first car I learned to drive in was a 6-shift Camaro that my brother had. After that, my next brother, he had a Ford Focus. Guess what? That was the only car experience I knew. I didn't know BMW. I didn't know Mercedes. I didn't know about all the chimes and the backup camera. I didn't have backup cameras when I learned to drive, right? I'm kind of aging myself, Jeanette, aren't we? But you know what? It's perfectly fine. And you know what? That car took me to point A to point B. I still turn back around when I reverse, because that's how I learned. So this is a big benefit to all of your facilities out there, especially if you don't have the big bucks of the Epics and all of that stuff, to train people and have them retain and don't lose them because of, I mean, there's so much entitlement that goes within hiring people these days. They only want to get a certain amount of money. They only want to work certain times. They only want to work on certain systems. It's ridiculous. I have coders that are like, you know, Bertram, I can't take the job. Why? Because he uses a system I don't like. It's crazy. And we have 250 people waiting for that same opportunity, but they can't take it. And even if they are willing to get paid half as much as some of these experienced people.
Yep.
So.
And marketability is knowing all those systems. Not gonna lie, I've been on everything that you can think of.
Exactly. So what Janita is saying is that for each and every one of you, even for the experienced people, I'm not just throwing you under the bus. I'm calling you up, okay? But the best thing for you to do is to be flexible in a marketplace like this. Because you know what? When things get tough, what happens? All of those things go out the window. If you don't have a job and you can't provide for your family, it doesn't matter what system I work on, Bertram. I just want a job. And then it becomes very real. But yeah, we're getting a lot of kudos in the comments. So what I want to do and what I need to do, ladies and gentlemen, I have to cut this short. All right, depending on the comments and some of the things that we get, I'm probably going to have a second live stream or something like this to answer more questions. But I really appreciate each and every one of you. So Janita, I'm going to let you go. Thank you for being here.
Thank you.
Ladies and gentlemen, thank you so much. Have a great rest of your day, and we'll see you next time. Okay, bye-bye.